Hello, all. Thanks for joining us this week on the Automated Advantage. This podcast is a casual chat with business leaders, getting their perspectives on business and different thoughts on multiple topics. Hopefully, you get something out of it. This week, we're talking to the CEO of the Health Business Growth Collective, Tim Organ, who's got some amazing insights on health, business, and different perspectives. So, look forward to this one. Hope everybody enjoys. Well, hi, Tim. Thanks for joining us today. If you don't mind just telling us a little about yourself and your business and introducing yourself.
Yeah, appreciate it, Greg. Thank you so much for having me on the show. Yeah, my name is Tim Organ. I am the CEO of the Health Business Growth Collective. We've been in business for about 14 years, and what we do is we help health business owners, and these are primarily, depending on where you are in the world. Here in the U.S., there, of course, are a lot of doctors, and a lot of those doctors are what we would consider entrepreneurs, right? These are the individuals that are not part of the system. They're the ones that, may have jumped out, or maybe very early on they decided to take a path through natural medicine, functional medicine, integrative medicine, a DO, a DC, all those different categories of doctors, not just medical doctors, but, other types of doctors and healers. And many of these individuals went to medical school. They didn't go to business school. So we're a company that helps these doctors or these healthcare practitioners or health business owners grow and scale their businesses. And we do this through a number of ways. Number one, we hold a big event every year. We call the Mindshare Summit. And that brings together, hundreds of these health business owners. And we just basically put them in front of, one another, right? Because it's really important for these doctors, especially since they're not part of large groups, not part of big systems. They're disconnected, and we were talking about that, about, when you get out of the world of you're used to going to office buildings and seeing people and interacting with individuals, that you get that connection, right? But these doctors are really working inside of a silo. They're working inside of their own businesses, whether it's a brick and mortar or whether it's a virtual. But they're always looking to find ways of basically making a bigger impact. They want to make a bigger income. And, they have to free up their time. They have to optimize their business in order to find that time to be able to spend that time writing that book, or being on podcasts or on stages, whatever it may be, creating content. It's so important that they are not in the day-to-day, right? So these are the things we teach them. We teach them how to create content and help them price it, package it, promote it. We help them optimize their business, and we help them scale their business through a number of different areas, whether it's a program or a high-level mastermind.
Oh, that's super helpful. So obviously, I looked at your background and I followed. So you've been in the quote unquote medical industry for some time. So you
Yeah.
somehow along the line said, there's a gap. I need to go fill it. So maybe take us through that
Yeah.
kind of thought pattern.
Wow, you opened up that one. Okay, well, let's talk about that, because it's a great story. Coming out of college, I was very interested in finding an industry that I can make a difference, right? And of course, a lot of my friends in college were, going to work for beverage companies or going to work for copier companies. I'm like, that just something about selling a copier or stocking shelves just doesn't, fill my need. And I looked at healthcare, and I had a brother who was in the industry, had his wife was a pharmacist, and I decided to take the path of healthcare sales, because I really love sales. I love marketing, and just started that path, and really was involved deeply in this, and it was definitely felt like I was making a difference in the world. And really throughout, I don't want to kind of drag this down, in all the things that I've done, but I rose within organizations. I worked in 7 total over 33 years. Basically leading high functioning sales teams, managing half the country, just doing a lot of executive work in the sales side of it. And, it was about 10 years ago, I met a woman that later became my wife, and she had, basically, she was a big name in the fitness world, in the health and wellness world. She had a private label brand where she sold supplements and protein shakes, and a big influencer in that world. A four times New York best-selling author, Fitness Hall of Famer, which was amazing. But I also realized she had another business, back in the day, we called it Mindshare Collaborative. And she started that 14 years ago. And that is that professional business that we now call Health Business Growth Collective. And the last company I worked for was a company in the basically you could call it Big Pharma's drug delivery network. This was a private company owned by the Pharmacy Association that had all the pharmacy benefit managers. These are, again, if you're not familiar with the US, these are the organizations that basically manage prescription benefits. So they're the ones that say, hey, you get this drug, it normally would cost you cash, $100, but you can get it for $25, right? So they managed all of this. The health insurance companies ended up buying these pharmacy benefit managers in the latter part of the decade, right around the 2018 timeframe. You saw a lot of industry consolidation, and I started to realize that this is a company that when I'd go to national sales meeting, they were celebrating new prescriptions, and I'm like, wait, hold on, like why are we celebrating basically getting more toxins into people's bodies? And I'm just going to be brutally honest here, when I'm in this other world of natural healers and this convergence of what's going on over here, what's going on over here, I see things that aren't just connecting. And I started to become more aware, and I started to ask more questions. And that didn't go over well. That didn't go over well in the company I was with, and or the doctors or the health systems I was calling on. And I started to realize that, whether we want to talk about it or not, that there was a lot of corruption going on, and there was a big, big budget. Of course, I think we're up in the U.S. here alone. I think we're at 4.5 trillion is the budget for healthcare, right, in this world, and it's not stopping. And we've seen chronic disease rise. We've seen a consolidation in the industry, not only physician practices but hospitals. The big healthcare systems are getting bigger. The independent doctors are going away, and they're now becoming system doctors. And there's no more time to really spend with the patient, and they're really not getting to the point where let's figure out what the root cause of the challenge that these patients that are walking in the door. And in many cases, the root cause is, well, you're basically not treating the cause, you're treating the symptom, and you're treating it with a pharmaceutical. You're treating it with other things that just aren't natural for the body. And you may have heard it, but you basically, food is medicine, and there's a lot of natural healing that can happen. I mean, just simply by sleeping, exercising, and eating the right things, it's amazing what happens to your body, right? Like, wow, like if I didn't eat that ultra processed food, how much better do I feel if I have more protein, right? So these are the things that started happening. And there was a big event, of course, that happened in 2020, and I wasn't the right person for the organization because they were looking to me to do a certain thing, and I wasn't going to do it. And I'm like, you know what, I'm out. So I jumped out in 2022 and really came over to this side, and was very passionate. And the great thing was I was in this world for a good 7 years, and really got to know these doctors, got to know the company, got to know just the industry itself. And I had so much more alignment with the natural healing side than I did with the traditional medicine side. And so it became very apparent for me that there needs to be a bigger voice in the world, with regards to not only the amazing community you have, but just the industry itself and these natural healers. And I threw everything down. I said, I'm all in. I'm all in to really building this company, but just not only building a company, building a community and building a movement. And that's what we're doing right now. We're building a movement to what I would refer to as a new health paradigm, about setting up an environment where natural healing is happening. Like, we're bringing in things like meditation. We're bringing in things like cold therapy and saunas and red lights and supplements, brain retraining, all these things that have been lost. Eastern medicine, like, where did Eastern medicine go? After the early 1900s, when Rothschild basically, captured the entire industry and, started putting his petrochemicals into pharmaceuticals and started patenting things where they're natural herbs. So we went off the rails, let's just say about 125 years ago, and it's time to put ourselves back on the rails of natural healing.
I love it. People would not believe that you and I only just met today, because like you're preaching to the choir. So I just nodded my, but I'm a triathlete. I've done multiple Ironmans. I've figured out eating and supplements and all of that as to, it's shockingly enough has made me a better athlete. And my wife, who's premenopause and those types of things, has been doing this study and also just we're going the natural route, and what a phenomenal difference. It's just like some of the stuff, it's, they say common sense is not so common. It's just like when you look into the details, like, oh, of course that makes sense.
Yeah, yeah.
So
Have
that's
have have
incredible.
you yeah, have you ever heard of Brian Johnson?
No.
So Brian Johnson, he lives here in the U.S. and he's a guy like he's a tech billionaire, right? I think he had a payment company that he ended up selling, and he decided to go all in on really longevity, right? He wants to live to be 100 and some odd years old, 200 years old, whatever it is, and so he started to hack his health. He invested he's invested millions in his own health and really trying to figure out, with high-end MRI machines, he goes to sleep like at like 6 o'clock or 7 o'clock, and he gets 100, he gets perfect sleep scores every day. Like he is so regimented and so rigid and tests literally every day. And and guess what he found out after all this investment? Exercise, diet, and sleep.
Exactly. The three.
Okay, that
There's
doesn't
no
cost a whole
magic.
lot.
There's no magic pill for that one.
There
I mean,
is
just
no magic pill for that one. Yes, Greg.
to finish that off too. It's like, I mean, obviously watching TV and things like that and see all these commercials. For the first time in my life, I saw one on Sunday saying, if you have, people have problems and all of this stuff, and it's more to make a point than it is to judge anybody. But if you have a drinking problem, take this pill. Like it's just.
The what? Yeah.
So
and by the way,
point.
By the way, this broadcast is sponsored by Pfizer, right? It's
so,
like, when is that going to end? Like here in the U.S., like we still have pharmaceutical companies basically keeping television networks alive with all their funding, right?
It's incredible. Seems like every commercial. But anyway, so so you talked about your client base and what you're doing. So how you've got the event that I understand, but how are you attracting people to come to talk to you folks?
Yeah, it's a great question, and it's multifaceted, right? I mean, one of the things we do here at the Health Business Growth Collective is we're very proud of the community that we've established, and this is an amazing community because it's great to hear when individuals first come into the room and they're like, "Oh my gosh, I found my tribe." Like, where have you been my entire life, right? Because they are what I would refer to as renegades, as rebels. And I just launched a new podcast, which is going to be launching in November, called Rebels with a Root Cause. And it's really about talking to these doctors who were either in the system and jumped out, or just decided not to go that direction and, may have been canceled. But, just really just work through it, right, to get out on the other side. And many of them have better businesses because of it, right, because they're more resilient. But that's really what this is. And the way we bring folks in, number one, our community brings our audience in. We love our community, and our community loves to share what they've learned and how they've grown. So our biggest referral source is our own members, right? Because they know the value of this company. They know the value of what it put in place for their business, how it freed up their time, how they were now able to spend more time with their family, how they're not burned out anymore, right? They've got an optimized business that's just running and scaling. We also run ads, of course. We mail to our own list, and we go to other conferences. But at the end of the day, it really comes down to trust, right? Trust is the most important thing. And when they hear it from a friend versus clicking on an ad, we see higher conversion rates, right? When those individuals say, "Yeah, I'm in, like whatever you're doing, I want that too." And they come in and they end up signing up for a program. They end up, if their business is at the high enough level, they sign up for our scaling mastermind, because they know that they've got something special and they just need to amplify it. And, in many cases, getting folks that come in on ads, they're walking into the first time, like, what is this? I don't know anybody here. It can be a bit overwhelming, but we have a way of cracking that, or a big event, to really open them up and get them to look at what's possible with them. And it's kind of funny. We do a costume party every Friday night of our event. And, 1 year we did, "What do you want to be when you grow up?" And we told them, we said, "You can't be a doctor." And they're like, "What do I do now?" Right? So, but they show up, and it's amazing what happens from Friday to Saturday, because they're when they put a costume on, they become superheroes. And our theme this last year was a superhero theme. And it's amazing when they put the cape on, they become somebody else. And the difference between Friday and Saturday is cataclysmic. Like, it is like massive. It's it to see the smile on their face, the brightness in their eyes. They come in and they're like, I'm ready. Like that thing last night, like just I took off all the imposter syndrome and I put on my cape. And now I'm soaring. Now it's ready to really absorb this. So I think that's a long way of saying, we are not a traditional company. It's not a traditional industry. We need to leverage what we know, and what we know is our community.
Well, that's a good thing. I was thinking about it earlier too. Is some of the best businesses that exist today have been disruptors. So
Yeah.
let's suggest that this is the beginning of another disruption.
Yes, it is. Yeah. Yeah. We've
So
been at it for 14 years. So
yeah, well, that's good.
yeah.
That's incredible.
Yeah.
So thinking about just you talk about the company and all of those things, and get a little bit down to some business tactics and if there is such a thing. And I know you're also a
Mhm.
smaller company and things like that. Like, what does a typical day look like for you?
It's a lot of so for me and my wife, we of course are on a lot of podcasts. We do a lot of interviews. Um, we work with our team internally. Like we are somewhat of a cyclical business. A majority of our business or our revenue comes from our big event. That happens in the fall, in the September timeframe. We also run an online conference in March. So we're always, getting ourselves ready for the next conference. But what we've realized is that we can't live in this cycle anymore. We have to find ways of introducing, revenue streams when the months are what I would say the dark months, right? The months that when our mastermind cohort, our programs cohort, one of our program cohorts starts November 1. And then, we're really post event. So, we're moving towards the March event. And normally those times have been pretty quiet, but we're disrupting this now. We're disrupting it with the way we look at how we deliver our services. And one of those is a program that we launched, which we call the Health Business Optimizer. We launched that about a year ago, and we figured out what we need to do to make this thing one of the most amazing programs for any health business owner that is stepping into this world. And this is the optimized piece. This is where they can step in at the beginning of any month or any month, and step in and just get on the ride, so to speak, right? Where they're going to learn all those things that they need to learn for their business, and they can bring their teams in, because that's so important, because you have these doctors who are visionaries, but you got to bring their teams in to really help them in their businesses. And you have to free up the visionary to be a visionary, right? You have to give them the time to create, to have the time to think, what can I do that I can make a 10x impact, right? In the world of health, in the world of my business, knowing that my team has got me, right? They've got this business. And that's so important, because if they haven't optimized their business, they're on, sand, like they don't have a solid foundation. So that's the most important thing. And I think we're going to start to see that. And, we're also leaning into like personal brands. Like personal brands are going to be so important right now in the age of AI, because we're seeing it right now already that, folks are taking their labs, they're running them into ChatGPT. They're saying, interpret this like a functional medicine doctor, or like Dr. Mark Hyman, who's a good friend of ours, and give me a treatment plan that includes supplements and diet and exercise and all that. And it's amazing what's being produced by ChatGPT when they put these labs into there and have it read it. So, our summit this last year was really about building your personal brand. And it's important that doctors, any business owner, looks at it and says, what is AI going to replace? And what is AI going to replace me? Right. And we all know that AI is coming for all of us. So, the one thing that we know at this point, and this could change, of course, is that, people want they want connection, right? They want to know that they're talking to somebody who's real. And these AI videos are getting very, very good. And that's a great thing, and that's a frightening thing. But at the end of the day, they want to know that they go to a conference, that they see somebody, they want to interact with them, they want to, they want to learn from them. This is what we're teaching our audience to do, is to build that brand. Because if they haven't built a brand, these conference companies aren't going to reach out to them and say, hey, we've seen some great work that you're doing. We'd love to have you at our conference. We'd love to have you on our podcast. We'd love to have you do these things. And that's the most important thing right now, is that they really lean into their brands, because AI is listen, it's doing some amazing things. We're leveraging it all the time. And that's what we're doing as well. We're really leaning into how can we build out GPTs for our own audience? How can we make them more efficient? How can we make our company more efficient? and how can we, get the word out there more. And so we're always looking for ways to promote who we are and what we do. And the best way we can do that is just to be on shows like this to get the word out, to know that there is
No,
an
that's
alternative for the healthcare practitioners.
I mean, I'm glad you saw, because one of the topics was going to be that. So you naturally transition into that. The thing that I'm seeing, and I know you agree with it, is, and particularly in your world, as I think through it, is so many people just think AI is Chat GPT, and I think yes, it's going to take away some of these mundane things, but I still feel that you need somebody to check the homework. So in your industry, it's
Yeah.
great, it gives you output, but the doctor needs to look at it and say, listen, don't
Mhm.
don't do this thing because it's going to impact that. So I like the combination of the two things, but I think that just some of these mundane tasks it'll take away, or it'll get us closer to the answer a little faster. But you still need to check the homework and don't believe everything
Yeah,
that
yeah,
comes out of it.
yeah. And also read that little fine line that they have in ChatGPT that basically says, we make mistakes. So we're not
Yes.
responsible for the output. And it's like, this is your health. Like you want to throw this into chat and really have it diagnosed. Like, who's it talking to on the back end? Where's it getting its information? And yeah, it's probably for the most part, there's probably going to be some inaccuracies in it. And that's why you need a doctor who understands, the challenges you're having in your health, whether it's hormone, gut, brain, whatever it is, like, and how you can address it with things other than, supplements are great, of course, but you have to look at other things like peptides and stem cells. And, especially if you're in the world of fixing your body, which I'm fixing my body all the time, and I'm constantly doing peptides and stem cells and PRP and other things to alleviate the aches and pains that I put on myself many many years ago. Just like you as a triathlete, I mean, you're putting a
Oh,
lot of stress on your body. It's like your body's like, okay, listen, yeah,
yeah.
I need some relief. Can you help me like bring me back to my natural state? And that's what these things do. It's not a pill. It's not a shot, right? Yeah, okay, a peptide, you can take it orally or you can inject it. But at the end of the day, your body produces these things, right? Let's put the natural things back in the body. Let's not put foreign things in your body.
And that's a really good point, because as my wife and I are busy in, evaluating this and doing stuff, and to your point is, if you take and say, look, do this, and they say, well, I'm just going to use a bad example, but take magnesium. But the thing is, if you don't if you take magnesium on its own, but you don't take X amount of something else, it's useless. And that's the connection that somebody needs to get out there. Is you think, oh, your friend tells you to do this or to do that, but it needs to come together and it all has to work as a system. And that's one thing we've learned significantly. It's like, I'm not
Yeah,
feeling any
yeah.
better. It's like, oh yeah, but you're supposed to take 20,000 milligrams of it to get any benefit, so you should do this.
Well, I mean, this is a great example, Greg, because not all magnesium is created equal, right? Especially if you're buying it off an Amazon. Like Amazon is not really testing any of these products. We have no idea where they're coming from. They're mostly coming from China. And we've seen, and through some individual, through some testing that we know of individuals that do these types of things, like some of them found no trace of magnesium whatsoever, right? So you have to make sure that you're investing into a quality product made by a quality company that has received the highest levels of certification and things like good manufacturing practices, other things, and knowing that what the product says the product is, because that's going to move the biggest needle. It's not about just taking magnesium from a bottle. It's really taking the right magnesium from the right bottle,
Mhm.
to help promote those health benefits. And it's true anywhere, right? We see it with stem cells as well. We've heard in many cases folks are medical tourism. They're flying down to different countries, especially in the South and or South America. And what they're realizing is that the stem cells that they're getting are 100% dead. Like there's no life in those stem cells, but they're still being injected in them, which is very toxic to the body, right? If you put in a dead cell, it's your body's going to say, "What is this? I need to get rid of this," and it's probably going to go to areas you don't want it to go to. And we've heard some horrific stories of deaths. We've heard some horrific stories around paralyzation, and it's so you got to be really careful about what you're doing. And so I think we're in an age right now where we have to take responsibility of our own health, right? We're seeing the democratization of health. We're seeing it in finance, right, with the blockchain and cryptocurrencies. We're starting to see a decentralized approach to this. And at the end of the day, it comes down to self-custody. It comes down to self-awareness. It comes down to you as an individual to say, I'm not just going to go blindly trust the white coat. I'm going to trust myself first, and I'm going to do the research. And that's where AI can really come into play to really help, provide some information for you that you may not have had, at your fingertips. So, there's a lot of great things you can do, but at the end of the day, be your own skeptic and make sure that you're making the right decision, whether it's your health, your finance, whatever it is, that you're the one that made the decision and not somebody else for you.
Yeah, no, I love that. I think it's preaching to the choir as we go through this stage of in our lives, and we've
Yeah.
seen the benefits of it. So we got about 5 or so minutes left. So what I wanted to just jump to is going back to kind of the business and you starting out, and let's just say some person. By the way, I'm 58 years old and I started a business not that long ago.
Mhm.
Somebody 20 something years old, somebody getting into business, like, okay, you know what? Here's 1 or 2 lessons learned, and maybe here's a piece of advice that I would give you.
Yeah. Yeah. I think two things. Number one, I just funny you've asked this question because somebody asked this question to me earlier, similar question. And, in my career of 33 years of healthcare sales, 7 companies, the biggest thing that I look for is culture. I'm a huge culture warrior. I love to create great cultures. I've got a great culture here at the Health Business Growth Collective, but I was headhunted many, many times by some very big companies. And I looked at him and said, I don't like your culture. Like I could be very successful there, but I will be miserable doing it. And so I always look for companies with culture. So figure out what it is that you want to do. Like who is it that you want to work with and what's going to feed you? Because at the end of the day, it's not about the money. It's really about how well you are in that environment, how you adapt, how you work with others, like how they're like really uplifting you and making you a better person, right? And you also need to stay away from companies that want you to be transactional, right? I'm a big believer in transformation. Like you have to become someone else, right? You have to become a better version of yourself. And if the company is not supporting you in that, then I would say go find another company because they need to have a positive influence on you, and they need to show you the way in many respects. And you can of course do all that on your own, but it's really good to have a company that's in there. The last one I think is the most important, which I didn't figure out until later, is and it hit me many years ago. I'm like, oh, I get it now. It is, are you entrepreneurial or are you not entrepreneurial? And you either are or you aren't, right? And if you're not, don't try to pretend to be an entrepreneur because you're going to lead a miserable life. But if you are, stay away from the big corporate environments. And I realize, just looking back on my past, like in college and growing up, like I was an entrepreneur, and I jumped into the world of big healthcare, and I found safety and security, which was great for a time. And then I'm like, okay, I feel like I'm in a box here. I got to get out. And what I started to do was, as I started to evolve in my career and became more successful, and as mentioned, companies started coming after me and say, "We'd love for you to work for us. This is what you'd love to do." I said, "Listen, I would love to work for you as well, but here are my conditions. Like, you're not going to micromanage me, and I need a team, and you just basically get out of my way and let me do what I do, right?" And every year I was always hitting my numbers, President's Club, you name it, like. But I had to find those environments, right? It goes back to the culture. It goes back to who you really are and who you want to be in these environments. And so it was very easy for me to live in that world, doing what I was doing, not being completely controlled and micromanaged, but having some governance over my own environment by setting it up early, right? Letting them know what the intention was of what I wanted. But it was easy for me to step out into the world of, let's call it a small business, right? Even though it's a multi-million-dollar business, it's a small business. And, being able to, everything I learned there, extremely valuable, right? That I now use and deploy here, but I have a much different mindset, from more of a visionary, more of a creator versus more of a transactional, doer. And transformation is a big part of this company, a big part of our community. And it's the only way of really freeing yourself and being able to get yourself to think bigger, and to think smarter.
Yeah, and I echo that. I worked for 3 of the largest firms and the name brand companies, sales numbers, also President's Club, and I told somebody this the other day. I've never felt more liberated in my life, just doing it the way that I want to do it and creating the culture that I want to have, and having the work ethic and the integrity. To your point about the transactional thing, it's like, if we do business together, we do business together because we like each other, because we trust each other, not for any other reason. And that's what we're
So
employing.
true.
So you're, again, the health thing, the business thing, we're preaching to the choir. We're talking
Yeah.
the same truth. Just before we wrap up, I don't know if you want to
Mhm.
share the names of those books again, and maybe the website and all of that, just so that people
Yeah,
can.
yeah. Yeah, so thehbgc.com, that's hbgc.com. So that is the Health Business Growth Collective. And we've got a number of things. We also have a platform for health business owners to go find amazing companies to help them in their business, as well as help them make money as well through affiliate type of relationships where they can, resell their products. And that's called the Health Biz Hub, healthbizhub.com. So those are really the two platforms for us. But if you're a healthcare practitioner and you're really looking to, like, you feel like you're stuck and you want to find a way out to, free up your time and to make some more money and really optimize your business, check us out, thehbgc.com. Yeah, it seems like we got cut off.
You know what? I had this freaking problem with the AWS thing. This is hosted on AWS, and I think we have
Oh no.
a lagging problem with that. But you know what? What we can do is just, let's do that last little bit one more time, and
Okay,
then
cool.
I'll chop that piece out. So just do. I think we got BizHub,
Awesome.
and then
Yep,
sorry,
yep. You want me to just start all over again?
yeah, just do that again, and then I'll cut that little bit out.
Okay. Yeah, great question. So you can find us at thehbgc.com. That's hbgc.com. And if you're a healthcare practitioner that is feeling like you're stuck, looking to really grow, not only professionally, but personally as well, like, come check us out. We've got an amazing community. We've got some amazing ideas for you and your business. And at the end of the day, we want to free up your time so that you can make a bigger impact in the world of health. We also have a platform we call the Health Biz Hub. This is a great platform for you for your health business. So if you're looking to find some great business services, or you're looking to make some more money through affiliations, like reselling products, we vetted these companies for you, just so you know, like, this is the most trusted directory in health for companies that you can work with. So I invite you to check us out.
Well, thank you so much for taking your time today. I really appreciate it. And people go and look at this. This is the way of the world. Please do that. So thank you so much again, Tim.
Thank you, Greg. Appreciate you.
All right, there we go. So I've stopped that. You there?
All right. Hopefully we
I
got that
know.
one.
Yeah, we know we got that skit. So hey, I truly appreciate that. This was, I mean, it's so funny. You and I hadn't really. I looked at the stuff and I didn't realize what it was. And it's like my wife and I are going through that. We have for the last few years, right? Just been going through that journey of health and 58. I started triathlon and I did my first Ironman at 51 years old.
Wow. That's
It's not
crazy
like
good. Yeah.
it's not like, and I've done 19 and a half Ironmans and 4 Ironmans since then. So I just, we're
It,
constantly doing
and
it.
have you done Kona? How many times have you done Kona?
I'm not good enough. I have a real job, and I'm not. The problem is in my age group, it's half the guys are retired, and all they do is train. They're all
Yeah, yeah, I
semi-professionals.
get you.
So,
Well,
so
I
I wish
turned
a couple of my
61 in
friends.
September, and
You live.
I'm still on the beach in I play beach volleyball
Yeah.
all the time, so I'm still on the
Where
beach
are you?
playing.
Where are
And
you based?
I'm in Florida, Tampa.
Okay, yeah.
How about
You're
yourself? Where are
very.
you?
I'm in Southern California, San Clemente, so
Okay.
also
What part?
beach community. San Clemente.
Okay, yeah, I grew up in Del
So
Mar, and yeah, raised
nice.
my kids in Cardiff and San Diego guy, San Diego
Nice.
State.
We love
So
it.
yeah,
We
yeah,
love it.
it's
In fact, my son got married on Sunday. He lives
oh,
down
great.
there. He's in the Navy, and well, he's going to be moving to Virginia now, which is really annoying.
Yeah,
But
yeah,
but
great.
we love it.
Yeah, it's I love San Clemente. Like if there was another place I would live, I lived in Corona del Mar for about 5 years and loved it
Okay,
up there, but it was a little too crowded. But I'm like, San Clemente is like this little hidden gem.
it's perfect. I
Yeah,
did the
yeah.
whole thing too. I tell people this all. I bought a 1971 VW bus as well, so I'm like in the community.
You got the Woody?
um,
Did you turn into a Woody with the surf
No,
racks and
not
the whole
yet.
thing?
No, no. I just got a couple of surf racks on the top, and we take our
Nice.
friends every Wednesday night. We have a standing event. We go park down at the beach, and people know we're going to be there, and we have like
Great,
8 to 10 people every Wednesday night just hanging out at the beach. So
great.
it's the blue bus, and everybody sees it. They know where to stop. So,
It's
um,
iconic. I love it.
yeah. So, hey, I don't want to take too much more of your time. I do appreciate this. I would love to set up another call with you to kind of, we'll look at the video, but I think we didn't talk about it. So what I ended up doing, and it's very, in a way, similar to what you guys are doing. I bought into an agency that does AI automation, and it does it for a lot of different
Mhm.
things, but specifically around sales and marketing type of stuff. So, for example, like a really well defined cold email thing. There's LinkedIn campaigns. There's
Right.
SDRs to attract from your website. So whether you guys use it in your own business, but it sounds like even it might be something worth looking at for that tech biz thing that you were talking
Yeah,
about
yeah, yeah.
to
That's
share with
exactly
folks.
why
So
I built that platform was to be able to bring on companies like yours, for our audience, because we
yeah,
know if they click on a link and somebody tells them about something, it's like who knows, who's
yeah,
vetted this company, right? So this is why I set this up
exactly.
because we saw hundreds of thousands of dollars people investing and they got nothing, right? They didn't
Yeah,
they
yeah.
didn't get what they were promised, and I said enough. So we have about 125 businesses on this right now, and we're
Wow,
growing,
that's awesome.
and it's just really about
Yeah,
giving back to the community. That's the most important
yeah.
part.
And what I'll do is I'll send you just a little blurb on it, just
Cool,
so you can get your head around it. But it's the same thing. I vetted the living heck out of it. So my
great.
short story is, I went talk about culture. I worked for a company that had phenomenal culture. Loved my boss. Everything was amazing. Accenture bought us, and I was like, I
Mm.
know I don't want to do that. So I waited. I was in the leadership team. I took a 1 year retention payout. I went to work for a friend who wanted me to turn his business around, and it was like after 3 months, I was like, "This is it's just the culture." When you talk the
Yeah,
words culture, but your actions are not the same. I was like,
right.
So while I was trying to solve some of our sales and marketing problems for him, I came across this company and I vetted the living heck out of it, and ended up buying. You buy into it's called the growth platform. So they
Mhm.
coach you, give you tools, do all of this stuff. So I think, I mean, I feel like it's super legit, and it's been nothing but successful for me. So
Right. Right. Yeah. This is
so
this is this is a big focus of ours, the AI side of this, like getting the best companies in place, right? Because you have something that probably nobody else has, and somebody's going to need.